Hi. I'm supposed to redo my um inspection of the lungs and auscultation of the anterior and posterior. Then I'm supposed to mention my part of my mental assessment, the cognition area. In the
The
cognition
tests.
area, the cognition test, I did the first one I did was the um trying to remember. The one I did was patient was alert to person, place, and time. And I did attention span, and you asked me to explain some other things that I can do. So I can check for memory. For memory, I can check for immediate memory, recent memory, and remote memory. So for immediate memory, I'm gonna say a word, then you say it back. The term is ending soon.
The term is ending soon.
Yeah, so my patient was able to verbalize what I said, which is for immediate memory. And for recent memory, I'll be asking my patient what she had for breakfast. Dorcas, what did you have for breakfast today?
I had a sandwich.
A sandwich. Okay,
Yeah.
so Dorcas replied that she had a sandwich, so which implied that Dorcas' recent memory is intact. And for the remote memory, I'll be asking Dorcas a question, which is gonna answer me. Dorcas, where were
Yes.
you born?
I was born in Nigeria.
Okay. Which state?
I was born in Lagos State.
Okay. Dorcas was able to verbalize where she was born. She was born in Nigeria in Lagos State. So that's another test I can do for cognition. And for attention span that I did, I gave Dorcas a book that was in my other video, a book, and I gave her instructions of what to do. And Dorcas was able to do it. Another thing I can do is if Dorcas has been going to the store for a long time, maybe for the past 5 years she's been going, and she does her list herself, and I tell Dorcas, oh, okay, you want to go to Superstore, can you make a list for yourself? If Dorcas can't do that, she can't complete making a list that she's been doing for 5 years, that's another test I can use to test for attention span. Thank you. So I'll be going into inspection inspection of the anterior chest and the posterior chest. Okay, Dorcas. So I'll be doing inspection of your chest, both the anterior and the posterior. So this is the anterior. Dorcas, can you raise cloth up a bit for me? So for this, yeah, I'm gonna check. I just inspected Dorcas anterior. I'm gonna be checking posterior as well so that I can talk about the two at the same time. This is the spinous process. Just want to be sure that it's symmetric. Okay. Okay. Thank you, Dorcas. So I just inspected Dorcas's anterior and posterior chest. So for the anterior chest and the posterior, the skin color is consistent, and I didn't see any lesion on it. There was no mole. The muscle have developed appropriately for Dorcas' age, and okay, just want to be sure it's recording. And I checked Dorcas' lips and her nail beds. Okay, her capillary refill, which is it's refilled back in 2 seconds. So I checked her Dorcas's nail bed. I checked her lips. There's no sinuses present in it, and Dorcas's facial expression during breathing was relaxed. Her breathing was not in distress. And I checked the spinal process, and the posterior is in a straight line. So I'll be checking for inspection as well. I'll be checking Dorcas' breathing. Oh, my wristwatch. So I'm checking Dorcas' breathing, her respiration. Okay, so I just finished checking Dorcas's respiration. Dorcas's respiration is 20, which is okay. And there's no I'm supposed to check her oxygen rate, but I do not have a pulse oximeter here to do that. So yeah, it should the pulse what's it called, the oxygen saturation, which is the SpO2, should be between 96 to 100%, but I do not have that. So yes, I'll be going into auscultation of Dorcas's anterior chest. So for Dorcas's anterior chest, I want to auscultate for her lung fields from the anterior chest. So I'll start from the apices of the supraclavicular area down to the sixth rib, because the lungs, begin at 3 to 4 centimeter above the clavicle, that's above the apex, and extends down to the sixth rib in the mid clavicular line. So I'll progress. I'm going to do it from side to side. I'm going to start from the right side, go to the left side, go down to the second ribs, which is this angle of Louis. So I'll do that process. I'll be checking in 5 different places for Dorcas. So Dorcas. Once I place the diaphragm on the stethoscope on you, you're going to breathe in. Okay. I'm going to the third rib. I don't want to do it on Dorcas's breast tissue. I have to make sure it's on the rib so that I'll hear the right sound. I do not want to hear adventitious sound. I want to hear vascular sound. So I did this, then I did this. So okay, I can start from the so. Okay, so I just auscultated Dorcas's um, anterior chest, and I didn't hear any adventitious sound. What I heard was vesicular sound. So I'll be going over to do Dorcas's posterior chest. And for the posterior chest, I already did the inspection. So I'm gonna sorry for the sorry, I don't want to laugh here. So for the posterior chest, I'll be starting from the apices of the C7 down to the T10 at the base. So Dorcas, please, I don't want to redo this video. Yeah, so yeah, your C7 is one that put there. The next one is T1. So I'm going to be starting. So please, Dorcas, whenever I put my stethoscope on you, you're going to breathe in, take a deep breathe in. So for the auscultation that I'm doing, I made sure that she completed a respiratory circle, which is inspiration and expiration, to hear the sound. And I do not want to hear adventitious sound, but vesicular and vascular sound. Sorry, and vesicular. Okay. Deep breath, please. Thank you. You can put on your clothes back. So I just auscultated Dorcas's posterior chest, and there was no vesicular sound in it. There was vesicular sound, sorry. There was no adventitious sound. So that brings me to the end of this video that I'm supposed to redo those areas you asked me. Thank you.